not too far, right there, and just let you smile. And already you can see what she's doing. You over-corrected that, but you can see the sway, can't you? It's coming this side. And then you corrected that volitionally, didn't you? Yeah. So she's coming this way. Yeah. All right. Relax. Just check the tone here, and now she's got a lot of movement there, but the right one is off a bit. The right one's not doing as much as the left one.
Audition for The Exorcist.
Head back. About there. Close your eyes. Don't let me push you over. And there's your positive. All right. See what she's like the other way. Ready? And there's. Do you see the reaction to this? As soon as I touch her, she responds to it. Now, ready again. All right. It's not as good as it should be, but this one has got absolutely nothing. And she doesn't know what to do about it, do you? I mean, I could keep doing this all day long, and she wouldn't get any better at doing this.
Try harder. Come on.
Yeah.
Use your head.
Bend and knee up. Close your eyes. Not bad. Now the other leg. Yeah, that's not too bad with it. But she's an athlete, aren't you? You do other stuff in running?
I mean, I used to play sports and got.
So actually, you know, she does. I mean, she does run and everything else. So the question is, while it looks pretty good, is it as good as it should be for an athlete? So especially on that right side, stand on the right leg again. And she's actually having to use a lot of effort to stay balanced. Do the other one. And that's a lot quieter.
She falls over.
Because she lost it. Okay, now we'll look for glitches. Follow. There it is, to the right. See it? It's not smooth to the right. In fact, it gets to the end and does that.
I was going to say, it's so fluttery.
Yeah. So let's have a look. If this is right, then I should be able to change a lot of this stuff by doing some.
Yeah, I see what you're saying.
And see if we can get rid of, or at least reduce that fluttering. And it is improving, isn't it?
Are you going more towards the left?
I'm going to the left, yeah. Okay.
Yeah.
So, feet together.
That's great.
Close your eyes, bring your head back, and balance.
Gonna ruin his directorial debut.
And I don't want to stand in perfectly still because you don't. But look at the difference in the sway pattern. It's actually changed a bit. She's coming back rather than over to one side. So she's got a second problem going on, but it's changed. Yeah? Relaxing in from every arm. This now should be way back here. They're fairly symmetrical. Yeah. What else was there? Balance, I guess. Yeah, I think it's better. Do the other one. So this is, of all the changes that comes on, this is the least consistent in its presence and its improvement. Okay, so she's got it, regardless of what she's telling me. I do know that she's had some head injury that's bugged it up. Something in her head, and
Writing
right reflex, yes, sorry. Can you do something else, head back? It's to the left, wasn't it? Don't let me move it. And there it is. I mean, it's certainly not perfect, but it is better. And that one's definitely better. But this one, she starts to get a sense of how to resist it, doesn't she?
Mm-hmm.
Yeah. Now, I can double check this if I really want to. It was that movement, wasn't it, to the left? So you keep my finger still, you turn your head to the right. Doesn't have to be too fast, but keep your eyes fixed on my finger. Yeah? And back again. Okay. All the way back. And this should screw her up. Okay, good.
Need more.
So, feet together again. Head back. Close your eyes. And there she goes again.
She's just still not burning.
Come back here, and there it is.
Yeah.
Yeah. And head back. And then push over. Better than it was, but it's not as good as it was either. It was better than the first time, but not as good the second time. balancing, it's only right leg. And that's not as good as it was last time I did it, but I don't know, it's been a bit iffy all the way through. But I'm really quite convinced now I can make it worse, I can make it better, that this is part of a problem. Or at least she's got this, whether it's part of a problem is another matter. Now for a tennis elbow, would I consider this particularly relevant? Not sure. What it's going to do is increase flexor tone. So for a tennis elbow, I'd suggest maybe not. This isn't particularly relevant for that condition. But let's say she was having trouble with the gastrocs. It does increase the tone in gastrocs, because the gastrocs is an extensor. And the extent with this particular condition, if I bothered, what I should have done, and you can do this with each other, is to feel the tone. You should feel increased tone through here. Actually, that's interesting, because we did, didn't we? That's a bit tone. But then you've got facilitating branch. But again, you can match this up. If I'm looking at flexor problems, then this might be relevant. If I'm looking at extensor problems in the legs, it might be relevant. Yeah. So is that okay?
So Jim, if somebody has increased flexor tone, why doesn't that make the extensors work harder?
It doesn't, that's what I'm saying to you. It's not particularly relevant for tennis elbow.
But couldn't that contribute to like a weakness, as it were? It's hypotonic relatively.
Through an imbalance.
Yeah, but it's hypotonic relative to the back. But I mean, it's not that the muscles are weak. I don't think it's a weak in the muscle. It just makes the tone a little lower as a form of reciprocal relaxation from the other muscles. But I don't think it makes the muscle weak.
But is it less tolerant to stress and strain? And
Why would it be?
Contributing?
The only thing a reduced tone might do is not limit the range of motion sufficiently. But that's not the condition we're looking at.
Right. So the firing pattern doesn't change, it's just...
Yeah, I don't see this as particularly related to weakness.
When you initially had her looking to the left of your head, so that was the vestibular-spinal system you're affecting, more or less? And then,
Oh yeah, I'm pretty sure it's the vestibular spinal system.
But when you incorporate the head movement,
That's still affecting the vestibular spinal system, but one's doing the vestibular ocular reflex and the other one's doing the cervical ocular. That's the cervical ocular reflex.
Okay.
Well, actually, this is the vestibular ocular,
Yeah.
and this is the cervical ocular
Yeah,
reflex.
okay.
And the COR basically is a reflex that suppresses the VOR.
Okay.
But the VOR is your default reflex. Is that okay? So we should probably make her a bit better again. Well, there we go. Follow. I think this will work. There we go again. Now, if there is evidence of this, and she's coming in for whatever the problem is, then what I need to be doing, apart from treating the mechanical problems, the neurophysiological problems around the joint and everything else of facilitation, I've got to do something about the vestibular problem, which actually means ironing out these glitches, because that seems to work nicely at doing this. Iron out the glitches, so there's some to the left, there may well be some to the right as well, and up and down. Find them, iron them out, and then basically giving her balance exercises, and incorporating that with all the other treatments you're going to do.
When you do the ocular tracking, for the CVR, how does that affect the cervical? Like, I understand when you're moving the head that you're affecting the vestibular system. When you're doing priming the eye muscles.
Oh, this is all vestibular. If you're thinking the vestibular system only consists of the labyrinth and the nuclei, it's not.
No, I know, I've read the thing, I know it's affecting the spinal system, but I'm just wondering how that affects the vestibular spinal.
What, the mechanisms of it, the pathways? I have no idea. Obviously, it's got to go through the cerebellum. But you've got to remember that all of the cranial nuclei are connected to each other, some more so than others. The speed at which messages are sent between the cranial nuclei is really fast because the connections are very short. So all of this is together, and a lot of it is purely reflex. For example, if she's looking this way and I come out the corner of her eye, all right, she's seeing me with cranial nerve 2. Yeah? Now, she wants to look at me. What nucleus will she look at me with? What will make her turn her head?
Her eyes are ahead.
Hmm? Her head. She won't do that.
Right.
That's not what you do.
Right.
If you get a visual image out, you do that. You don't sort of just do this with your eyes.
Don't you move the eyes first though?
No. No, that, and you're over there. You're immediately over there.
What?
Yeah. So, what is it that moves her head? What muscles? No.
It's the corticospinal system that moves the head.
No. Not as a reflex. What muscles move her head? Muscles. No, the multifidate don't.
Rotated.
Which rotators? God, you're screwing this up. What muscle moves the head? There's two major muscles that move the head. What are they? No.
Sternocleidomastoid.
Sternomastoid and trapezius. They're both cranial muscles. Both cranial muscles. This is why. It's an immediate response to turn your head over there, look up. Yeah, and they're gross movements. They're all gross movements, and I do that. There's no refinement to them. For that, you need the smaller muscles. But they're immediate and accurate enough to get my eyes tracked onto something that's superior.
Have you seen a difference in diagonals when you're doing eye tracking? I had a patient, she was MBA, and they did a bunch of stuff, and she was kind of exactly what you described. She got better to a point, but there's just always something. So I did some COR, and it still didn't get much better, but then I did COR.
Well, so I say you've got to go through each one of them. You've got to get rid of what you're seeing. Essentially what you'll do is you'll iron these ones out, and when they're gone, you're going to be you actually work on the worst one first. All right? All I'm doing with her, we're just testing. But you actually, when you start working, you work on the worst control first. If they can do it, sometimes they can't do it. You'll start doing these and they'll get really dizzy. And you can't do it, so you have to go down a stage. So you do the one you can, but optimally you do the worst one first.
So you would check every single quadrant as well, not just...
Yeah.
Okay.
Yeah. Well, there was one other thing to this. There's two other things you can test. And they've both got to do with flexors. But one is rotation of the head. If I do that with her, well, I've done it now, so I'm not going to see much. And there, one of these will, well, both of them might be blocked, but one of them is going to be painful and blocked, and usually that's going to give you sort of a softish end feel. The other one, though, is going to be jammed end feel. It's often not painful. And on that side, you'll also see lack of elevation, and that's the side where you'll see restriction of retraction. So what it would have been this rotation, and take it that way. Actually, it's still got an element of it. That one has got a nice, reasonably capsular end feel, is it so? This one, though, is blocked right there. Now, some of that may well be a joint dysfunction, but a lot of it is muscular. And the muscle isn't, you're not getting the end feel from the muscle, you're getting the muscle to change the axis of motion at a joint, and the joint jams up. And that should go, actually, if I do enough of this, it will go, until I'm left with a pure segmental dysfunction. I better not pull her arms back because it'll fall off. And there it goes. Okay.
And you'll find restriction with the
yeah, the ipsilateral. So this will be ipsilateral to the neck rotation. So your pattern is abnormal Rombergs, abnormal or no writing reactions to speak of, flexor tone increase in the upper limb, extensor tone increase in the lower limb, rotations affected in the neck. Flexion and extension are generally okay, but the rotations are affected. One rotation, though, will be a jammed end feel. The other one won't. And ipsilateral shoulder elevation on that side will be restricted. And you'll get glitches on fast tracking, on one or more movements.
Do you do contours?
No. No. Different problem. Okay.